Beyza Dönmez from Anadolu. I would like to return to the medical evacuation topic and want to ask, especially as you say, many hospitals are not functional and what happened to Al-Shifa and Al-Nasr. I want to ask, do we have any update on the medical evacuation situation? Is any happened in the recent days? How many people evacuated, with what? And also, I would like to ask, do you have any rough number of how many people urgently need medical evacuation to stay alive? Thank you.
So no, we don't have numbers of how many people need evacuation. I think the destruction of civilian infrastructure and civilian order is also what is problematic in the space, because if you can't record, you can't quantify, you can't report, there cannot be a sufficient enough response to what is needed. Hence the continued call for an immediate ceasefire. It's to allow for a moment for, firstly, immediate return to humanitarian support and aid. But in the long term, the work that needs to happen to repair the systems of just health reporting and health data collection is going to be a very big task. Right now, we know we have a lot of physician organizations on the ground. We have aid organizations on the ground. But to give you the numbers and hold anyone accountable to the numbers, we don't have those. But we know that a lot of people have been evacuated to the neighboring countries and the regions. And even that in itself takes extremely long to complete as a process. And a lot of it has been left to those who can raise funds and crowdfund to do that. There isn't a systemic, structured, focused, and a deliberate intent to ensure that people's rights to health are protected. The response is coming from people themselves crowdfunding.
Just a little one, short one. I just wanted to ask, you said that, many people evacuated, but I want to specifically ask, does any evacuation happen recently in the last few days? Thank you.
In the last few days, I can't give you an answer, but I know that 4,373 patients have been assisted through the WHO work, but not as of yesterday or Saturday that I can't give you. But there has been evacuation. The approval rate is 47%, which is very low still, if you account the types of injuries that are being seen at the moment. And I mean, the point is that Gaza should not be evacuating people for support, right? This facilities and the health services should be able to adequately respond to their needs where they live and where they reside. So the medical evacuation is also just another layer of support, but it's not a permanent solution to what is needed. And we're already struggling with evacuations even before October the 7th, but the WHO and other agencies have been supporting with evacuations.